Hello everyone. Today I felt like talking a little more about thyroid disease. Thyroid disease is common and comes in two main flavors: too much thyroid or hyperthyroidism, or too little thyroid or hypothyroidism. Hyperthyroidism is less common, affecting about 9 in 1,000 people, with about 5 of those people having noticeable symptoms, while hypothyroidism is much more common, affecting about 138 in 1,000 people, with about 8 of those having noticeable symptoms. Thyroid disease is almost always autoimmune in nature, meaning it is caused by your own immune system, and like most autoimmune conditions, it is more common in women than men, in this case between 5 and 10 times more common. I think about thyroid disease a fair amount because I actually have low thyroid levels myself and take medication for it daily. It doesn't really affect my daily life in a significant way at all, and I'm not sure that I ever really had much going on in terms of symptoms either. In fact, I may have only had subclinical hypothyroidism in the first place, and been started on medication unnecessarily. We'll talk about the nuances of that later. This time around, I thought I'd try something different with the background, as the thyroid itself is one of those sort of nondescript, ugly, random lump of flesh looking organs, at least in my opinion. Sorry to all those hardcore thyroid stans out there. I do think it has a sort of interesting shape at least, but if you look at it in an actual, real human body, it's pretty hard to tell apart from all the rest of the red pulpy tissue around it. So anyway, I thought I'd try incorporating something more geometric in the background this time, more reminiscent of some of the more classic optical-illusion styles or patterns, just to make things more exciting, and see how that might turn out when combined with my signature art style. As a result, I decided to start out with the background pattern first to keep everything more precise, then draw the thyroid over it, which was a bit more difficult to do, but still manageable. I allowed myself to be a bit sloppier with lines and angles still, just because I knew I would be tracing over with thick, wavy black lines again, and I'd be able to cover up my mistakes, which may not have been the best practice, but it did help spare a little bit of my sanity, especially because my tools aren't very good either, and my ruler already has lots of divots that make it hard to draw straight lines with it if I'm trying to be precise. So what does the thyroid do anyway? Well, probably the simplest way to think about it is as a regulator of your metabolism. The thyroid secretes 2 types of thyroid hormones called T3 and T4, and without delving too much into the specifics, we'll just say that together these two help control energy use, heat creation, and gene expression in basically every tissue in the body. The thyroid can affect cholesterol levels due to its role in managing fat molecule metabolism. It can affect insulin sensitivity, and it is extremely important in growth and development. It also can affect heart rate, digestion, and stress. It's so important that it's actually on the mandatory newborn screen in all 50 US states. Now, that may sound like the thyroid does a lot, because it does, but the simplest way to think about it is that high thyroid hormone equals high energy and everything that comes along with it, like higher energy burning, higher heart rate, higher stress, hyperactive bowels or diarrhea, etc., while low thyroid hormone equals low energy, lower energy use, and therefore increased energy storage, leading to weight gain and higher cholesterol, fatigue, hypoactive bowels, or constipation. High and low thyroid can also affect hair growth in periods as well, although I feel like in practice these effects tend to be more variable and aren't as reliable of indicators. I'll also just briefly mention here that attached to the back of the thyroid are also the parathyroid glands that secrete parathyroid hormone, but even though they're connected, they're considered a different organ, so we'll just leave that for another time. Seeing as thyroid levels can affect so many different aspects of one's health, it's no surprise that we test thyroid levels all the time in primary care. The way we typically do this is with the test of thyroid stimulating hormone, or TSH, which is actually a hormone released from the brain that stimulates the thyroid, causing it to release thyroid hormone. This can be a little confusing because this means that TSH has an inverse relationship with thyroid hormones. For example, if thyroid levels in the body are low, thyroid stimulating hormone will be high, because the brain is trying to get the thyroid to make more thyroid hormone to make up for the low thyroid levels. The reverse is also true. If thyroid levels are too high, the brain will cut back on TSH production because it won't want to tell the thyroid to produce more thyroid hormone when the levels are already too high. So we typically start with a TSH level when we're screening. And if this is abnormal, we then test levels of T3 and T4, the thyroid hormones. Now, it is entirely possible to have an abnormal TSH and then go get tested and be found to have normal T3 and T4 levels anyway. The specific algorithms differ for both hypothyroidism and hyperthyroidism, but this would typically place someone in the category of having what we call either subclinical hypo or hyperthyroidism. In these cases, it may not be necessary to start medication at all, but there is a lot of nuance to that. For subclinical hypothyroidism, if anti-thyroid antibodies are found or you have treatment-resistant depression, it may still be advisable to start medication anyway. For subclinical hyperthyroidism, the testing is typically repeated again later, and if levels remain high, it will likely lead to a patient-specific conversation about risk factors and whether or not treatment is right for you. I was first diagnosed with hypothyroidism as a teenager, and honestly, I don't remember having any real symptoms at all. As a matter of fact, I'm not even sure whether or not I was worked up appropriately, and only actually had subclinical hypothyroidism instead. While there are some risks to overtreatment, as long as appropriate laboratory monitoring is done to make sure thyroid levels are appropriate, these are quite minor and uncommon. And now that I have a very busy job and kids to juggle, I'd rather err on the side of caution instead of coming off medication, just to test whether or not I actually have overt hypothyroidism versus subclinical hypothyroidism as a purely academic exercise. I already have enough of a hard time not falling asleep during conferences as it is. Thyroiditis, or inflammation of the thyroid, can occur for several different reasons. The most common reasons include Hashimoto's thyroiditis, postpartum thyroiditis, and subacute thyroiditis. Hashimoto's thyroiditis is caused by an autoimmune response, where your own immune cells damage the thyroid. Postpartum thyroiditis occurs within a year after pregnancy, and it is also typically an autoimmune response, just one that occurs specifically after pregnancy. Subacute thyroiditis usually happens after a recent viral infection. While many other things can cause thyroiditis, these are the most common, and the rest will apply only to a very small population of patients. Whatever the cause, thyroiditis typically follows a 3-stage pattern. The first stage occurs when inflammation causes damage to thyroid cells, which then release extra preformed thyroid hormone, causing levels to be temporarily high. The second stage occurs after this, when thyroid levels become low due to the cells that were damaged being gone, as well as reduced stimulation from the brain with TSH, because the levels were too high before, and so now there's a rebound low as the brain slows down TSH production. The third stage, which may or may not occur, is when levels return back to normal after recovery, although it is more than possible to remain permanently hypothyroid if damage is more significant. In most cases, the treatment for thyroiditis and the resultant transient period of hyperthyroidism is symptomatic in nature, often involving beta blockers to help reduce your heart rate and feelings of anxiety. Depending on the specific cause of thyroiditis, anti-inflammatory medications may also be given. There are many different potential causes of hypothyroidism. These could include causes affecting TSH production in the brain, like a pituitary tumor, medical treatments like surgery or radiation that were performed on or near the thyroid, severe iodine deficiency in places where this is common, although this is exceedingly rare in the United States due to iodized table salt, and thyroiditis, or inflammation of the thyroid, as mentioned before. The most common of these causes, which we already touched on, is Hashimoto's thyroiditis, which is autoimmune in nature, and can be confirmed with testing for antibodies that are reactive against the thyroid after TSH levels are found to be high. There is an exhaustive list of signs and symptoms of hypothyroidism, but some of the more common among them include feeling cold, constipation, having dry skin, fatigue, voice changes, and weight gain. In rare cases and severe cases, a special kind of coma called myxedema coma can also occur. If you are found to have true hypothyroidism, you will most likely be started on levothyroxine, or synthetic thyroid hormone, to help supplement your low thyroid levels. Unfortunately, this is not the most patient-friendly medication, as it's an oral medication and many things can interfere with its proper absorption. This means that it should be taken 30 minutes or more before eating, often first thing in the morning, or 2 hours or more after eating your last meal for the day. In particular, anything with high levels of calcium or iron will bind with the medication and prevent its absorption. So dairy, antacids, iron supplements, and some other medications should not be taken at or near the same time as this medication. That's one reason why consistent lab follow-up after starting the medication is also important, because it can help evaluate an individual's personalized steady-state thyroid based on their individual lifestyle and dietary habits. Hyperthyroidism can have many causes, including Graves' disease, toxic multinodular goiter, toxic adenoma, thyroiditis, and exogenous thyroid use, meaning taking too much external thyroid supplementation. The most common of these is Graves' disease, which is an autoimmune disease like Hashimoto's disease. And again, antibodies play a key role. However, in Graves' disease, instead of the antibodies killing and breaking up thyroid cells to release thyroid, like in Hashimoto's, they actually stick to the thyroid-stimulating hormone receptors and activate them, causing an increase in thyroid hormone production. This leads to high thyroid levels and can also be associated with a very characteristic bulging eye appearance, due to inflammation of the tissues around the eyes. Toxic multinodular goiter and toxic adenoma are two different flavors of overgrowth of the cells that produce thyroid hormone, resulting in increased production. Thyroiditis we've already discussed plenty, and is usually only a temporary cause of hyperthyroidism. The most common symptoms of high thyroid levels, also known as thyrotoxicosis, are weight loss, feeling like your heart is beating irregularly, and heat intolerance. And sometimes the thyroid gland itself, which is located on the throat, can be tender and or very swollen, which is sometimes called a goiter. In severe cases, something called thyroid storm can occur, which can lead to organ failure and is a medical emergency. One unique feature of the diagnosis of hyperthyroidism is that in addition to TSH and thyroid hormone levels, a radioactive iodine uptake scan may also be performed to help examine the specific cause of hyperthyroidism, which can be seen based on the pattern of uptake. To help treat symptoms of hyperthyroidism, beta blockers are a mainstay. If the cause of hyperthyroidism isn't temporary, like in thyroiditis, a class of drugs called thionamides are also typically used to help decrease thyroid hormone levels. These include methimazole, the usual first-line medication, and propylthiouracil, which can be used instead in certain circumstances. For some patients, radioactive iodine treatment may also be pursued, especially if treatment with thionamides doesn't work after a full treatment course. The radioactive iodine works by killing thyroid cells, frequently leading to hypothyroidism later, which can then be treated safely with synthetic thyroid hormone supplementation. Well everyone, here's the final result. Let me know what you think in the comments down below. I guess the million-dollar question is if, as someone with thyroid disease myself, I feel like the mentally challenging effect of the optical illusion feels reflective of my own experience with thyroid disease. And to that I definitely have to say it does not. I feel like the background ended up looking quite different than I had expected, and instead of thyroid disease, it kind of gives more of like an evil thyroid that gained sentience, Halloween-y, maybe indie horror kind of vibe, once I added in the wavy line pattern. That or like Thyroid Disease X Infinity Castle collaboration. Either way, definitely a unique piece, kind of fun, but not quite sure how well it fits in with the other pieces now that it's all done. Let me know your thoughts, whether or not you also think it looks oddly sinister, and whether or not you plan on dressing up as an evil thyroid next Halloween.